everyone. So I've wanted to do this video for a little while, and I figured I finally have some time now, and I might as well just go ahead and get it recorded. I just recorded a video with my Amazon baby registry welcome box, so we're in the same clothes and in the same room and everything. But I figured I would just go ahead and, get this video made too. So basically I want to talk about this channel, like why I made this channel, and kind of where I am now with that. So anyway, I don't quite know how to introduce this. So it's basically about my health. When I initially joined YouTube and made a channel, it was actually a different channel, and that was back in 2008 maybe. It was quite a while ago, and I basically made the channel because I had found this community of people who were dealing with chronic illness, and specifically a bunch of people who were dealing with chronic Lyme disease, which I had been dealing with for quite a few years at that point. And so I decided to start my own channel to share my story and to kind of share my progress as I went along, and to kind of join that community. And that was great. I met quite a few good friends that I'm still friends with. I haven't met most of them in person, but we've formed friendships online, and that has all been really great. And then kind of the years progressed on, and I went through a lot of ups and downs with my health and everything, and shared that journey on that first channel. And then when it came time, when we got married and we're thinking about starting a family, I started looking for those kinds of videos on YouTube, and decided that I had kind of, the community that I had been a part of before, the kind of chronic illness community, had kind of dissipated a little bit. A lot of the people that had been making videos that had been part of that community had kind of faded away and stopped making videos, or not been as active. And so I kind of decided that I wanted to branch out and make a new channel, which is this channel, and share kind of the next step in my journey, and that is how I might go about getting pregnant and going through a pregnancy and dealing with parenting while still dealing with chronic Lyme disease. So basically, that was kind of the initial intention of this channel. It's kind of morphed a little bit into, I've kind of dropped a lot of the illness stuff, the chronic health stuff, and part of that has been that it hasn't been nearly as much of a focus in my life as it was before. So let me give just a little bit of background. So I was, when I was 15 years old, I was working at a summer camp, and I was outside all the time, and I grew up in New England, so this was in New England, and Lyme disease is pretty prevalent in the areas that I grew up in and that I was at the camp and everything. And that summer came down with what we thought was just the flu, but it was a little bit weird because no one else was sick, and but it seemed pretty typical flu. I got a fever and had a headache and just didn't feel well, was very tired. This was while I was at camp. So I took it easy for a few days, and then I think I went home for the weekend, and I recovered fine, and continued on with the summer. And then that fall started to get some more chronic, more severe symptoms. I developed chronic migraines that basically lasted for months and didn't really let up. I was very fatigued. I was dealing with some memory and concentration issues, and stuff like that. So I happened to be, at that time I was a sophomore in high school, and I happened to be homeschooled for that year, which was a blessing in disguise. That was not why I had chosen to homeschool, but it turned out to be really helpful that I had. And so we spent some time going around to different doctors. I saw a neurologist, I saw a chiropractor, I saw a number of different doctors who didn't really know what was going on. The neurologist had some possible things, but basically was very dismissive about everything. And eventually my chiropractor suggested that it's possible that it could be Lyme disease. And so she gave us the information for a Lyme doctor who was not too far away from us. And so we went to see him, and I was clinically diagnosed with Lyme disease. And I was clinically diagnosed because at that time, and for most of the time since then, I have not had positive testing on regular blood work. I've had some positive tests here and there, and I've had reactive bands on the Western blot test, but not enough for it to be deemed positive. So, so I was clinically diagnosed and started on treatment with oral antibiotics, and that actually was pretty helpful. So I was diagnosed right at the end of 1997, I believe, and then was treated for, I want to say like 5 or 6 months, and then switched to a different treatment, and eventually ended up stopping treatment because it didn't seem like it was really helping anymore, and the doctor that I was seeing at the time was not able to offer any other treatment options. So I just stopped treatment, and I was doing okay. And then I finished high school, and I graduated from high school, and I went off to college, and that change kind of brought about quite a bit of a crash in my health. So I again sought out a doctor, went to a different doctor, was started back on treatment, and kind of from that point on was pretty consistently seeing a Lyme doctor. I've seen a whole bunch of different ones in the Northeast, and on and off treatment, mostly on treatment. I started out with oral antibiotics again, and then in 2002, in 2002, I did my first course of IV antibiotics with a PICC line in my arm, and did that treatment for I think 6 months, and it did provide some benefit. It also caused gallstones, so I lost my gallbladder in that time period, but the treatment did help me quite a bit. And then my insurance stopped paying for the treatment, so I had to stop that and go back on oral treatment. And it was like from then on, it's kind of been just bouncing back and forth between oral treatment and IV treatment. I've done a lot of IV antibiotics, along with some other IV treatments, vitamins and supplements and fluids and all of that kind of stuff. I was also diagnosed in 2004. Let me back up a little bit. In 2001, I was also diagnosed with 2 other tick-borne illnesses, 2 other co-infections. One is babesiosis or babesia, which is a protozoal infection that's actually similar to malaria. And then the second one is Bartonella, which is the kind that I have is caused by the same bacteria that causes cat scratch fever. But when you get it from a tick, it tends to be more neurological, so it has the kind of different symptoms. So I've been treated off and on for both of those. And then in 2004, through a different doctor, I was diagnosed with basically, so the kind of parent term for it is dysautonomia. And I can't remember if I've talked about this much on here, but the dysautonomia type that I have is called neurocardiogenic hypotension. And basically that means that my autonomic nervous system does not work right, and the assumption and the suspicion is that it's basically because of nerve damage from the Lyme disease, that my vagus nerve, which kind of runs through and kind of controls all kinds of stuff with your autonomic nervous system, of stuff that you don't have to think about doing, that your body just does, like breathing and regulating your blood pressure and digestion and all of that kind of stuff, just doesn't work right. So with that, I can have drops in my blood pressure, and that was diagnosed through something called a tilt table test, which is actually like the worst test that I've been through in this whole process. And it basically tries to induce you to have this drop in blood pressure or to pass out. And it was not it was not a fun experience, but it did confirm that I do have this. And I tried a couple of different medications for that, but what ended up being the most helpful for me was doing regular daily IV fluids. So for a long time, I was on IV fluids every day. 1 liter starting out, and then eventually we found that 2 liters really was more helpful. So for a long time, for many years, I was hooked up most of the time to a bag of fluid and a pump in a little backpack that I would carry around. Somehow, through the process of my first pregnancy, that got better. And initially we thought that it was just because of the increase in blood volume that happens during pregnancy, because my dysautonomia is likely also related to having a low blood volume, and that's why the fluids help. So we thought that it was probably the increase in blood volume during pregnancy that was helpful. But then it continued to be better. So we're not entirely sure why that is. I have been off of daily fluids since probably about halfway through that first pregnancy. And this was after years and years of being on these daily fluids and really relying on them. So that was really great. So I've been diagnosed with all of these things and have dealt with all of this. And finally, I got to the point where I was getting married and we really wanted to start a family. And there's some level of there's not a lot of information out there and a lot of knowledge out there about how Lyme can be handled during pregnancy and how to best prevent transmission to the baby. So it is known that you can pass it along. You can, a baby can be born with what's called congenital Lyme disease, and often that results in it can result in kind of severe symptoms and delays and issues like that. It can also cause very minimal issues, and in some cases, even if the mom has an active infection with Lyme, she doesn't pass it on. So there's not really a lot of good information, not really a lot of good knowledge about how to handle that. But my purpose for starting this channel was to kind of share my journey and how I was handling it to help other women out there who might be going through the same thing. When I was, I think before we got married, when I was kind of interested in starting to learn about this, because I knew that I wanted to have a family, and I hoped that I would be able to carry my own children rather than adopting or having a surrogate, I started looking for information out there. And one of the things that I found was a blog that a woman had written for a few years at least, documenting her two pregnancies, and she had chronic Lyme disease, and how she treated and how she handled it and how her pregnancies went and all of that. And I found that really helpful, and just to find someone else who had been through this, because there's not a lot out there. So that was kind of the reason for starting this channel. It has now turned into something else, but I don't really want to lose that aspect of it. So let me just kind of give a little bit of information about how things were handled for my first pregnancy and how we're planning on handling things this time. And I know this video is going to be kind of long, but bear with me. I hope that this is helpful for someone out there. So for my first pregnancy, I was still in active treatment, but I had gotten quite a bit better and was kind of more or less stable. I couldn't really take long breaks off of treatment without having a relapse of symptoms, but I was doing pretty well and I wasn't needing heavy-duty treatment. So my doctor gave me the go-ahead to, like, you're go ahead and, try to start your family and all of that. And the assumption was that we would be treating with antibiotics throughout the pregnancy to prevent transmission. So the best way to prevent transmission that is kind of best known is to treat with antibiotics, pregnancy-safe antibiotics during pregnancy. If you treat with one antibiotic, you reduce the risk of transmission to a certain point, and if you treat with two, you reduce it really low. So there's a really low risk of passing it on. So when we decided that we were going to start trying, I switched off of the treatment that I had been on and made sure I got off of any other medications that weren't safe during pregnancy, and switched on to one of the two pregnancy-safe antibiotics that I was going to be on through the pregnancy. I switched to Ceftin, and I was on that twice a day. And then once I got confirmation that I was pregnant, the plan was to add in a second medication. The plan was that because I have a history of having had babesiosis, the plan was to have the second antibiotic be Mepron, which helps to treat that. But I ended up not really being able to tolerate it while I was pregnant. So instead of that, we ended up adding in a second antibiotic called Zithromax. So I was on the combination of those two antibiotics, the Ceftin from before I conceived and the Zithromax from about, I think, the beginning of the second trimester through the rest of the pregnancy. And I did pretty well with that, handled it well. And then I continued on the combination of those two antibiotics for the course of breastfeeding. So for the 16 and a half months that my son breastfed, I continued on those antibiotics to again hopefully prevent transmission, because it can also be passed through breast milk. Theoretically, there's not a lot of like concrete information, but the bacteria has definitely been found in breast milk. There have been some cases where people think that breastfeeding contributed to their baby getting sick. So there's not really a whole lot that's known, but we kind of wanted to err on the safe side, so I continued on those through breastfeeding. And then I did a little bit of treatment for myself once my son weaned, but then I stopped treatment. And I have now been off of treatment for over a year. And I have been doing really well, actually, considering stuff going on in life and all of that. I've actually been doing really well, and this is the longest that I've been off of antibiotics in a very, very long time. I don't know how many years it's been since I had a break like this. So now we come to the kind of the current situation, and I had talked with my doctor, knowing that we were trying to conceive, because we were going through all of this fertility treatment to try to conceive. It was not a secret or anything, and so I talked with her kind of before we even started the process of fertility treatment, and I've seen her every few months since then, and we've talked about it more. And she felt that since I've been off of treatment for such a long time and I've done so well, that I'm kind of considered to be in remission. I do have some symptoms still, but we don't really know if that can be attributed to an active infection or if it's just kind of permanent damage or what. Or if it's unrelated, like who knows, maybe I just get migraines, like we don't really know. But because I haven't needed treatment in such a long time and things have not gotten worse, the kind of assumption at this point is that I'm in remission. We don't know how long that'll last, but for now, that's where I am. So we talked about it, and she gave me kind of the go-ahead to make the decision myself whether I wanted to treat during pregnancy or not. If I were to choose to treat with antibiotics, then I would basically be on the same protocol that I was on during my first pregnancy. And we kind of went, had a little discussion about it, and I wasn't sure how I felt about it either way. It makes me nervous not to be on antibiotics, but again, on the other hand, if I don't have to be, and if I don't have to expose a baby to antibiotics, then I would rather not. So I wasn't sure how I felt about that. I knew that I would kind of wait and not start them right from the get-go like I did the first time, but and kind of try to weigh my options. So I have also spoken with my primary care doctor, who is a naturopath and also does treat Lyme, and she is also a midwife. And she has kind of, I met with her last Friday, and she kind of laid out all of the options for me. There's, on one end of the spectrum, there's not treating and just kind of watching the baby once they're born and hoping, waiting and seeing what happens. On the other end of the spectrum, there's basically the protocol that I was on last time, treating with the 2 antibiotics through pregnancy, through breastfeeding, and kind of erring on the safe side there. And then kind of in the middle, there are some other options. I could choose to go a more natural route, and there's a couple of different options with that, with some herbs that she feels totally comfortable using during pregnancy, and I really trust her judgment on that. There was kind of like a couple of different combinations of things. There's some things that she wouldn't use until at least the second trimester, but there were more natural options there. The kind of trade-off with that is, yes, it's more natural. It probably wouldn't have as much of an impact on the baby, but at the same time, there's really not a lot of good information about whether it actually prevents transmission. And then there's kind of not treating during pregnancy, but then testing the cord blood and the placenta, which I did do the first time. But personally, I don't feel like I bank anything much on those results. If they're positive, I probably wouldn't treat right away anyway. I would wait and see how the baby was doing. And if it was negative, I'm negative. Like, I don't test positive, so that doesn't mean a whole lot to me. So we talked for a while about all these options, and she was kind of, she gave me the option of like having some testing done on myself to see where things stand. But again, I don't put a lot of stock in the testing. So kind of where I fell at the end of that appointment was to not treat during this pregnancy and to keep a close eye on the baby and watch them when they're born, and keep a close eye on things to watch for any concerns. But because I'm doing so well and because I've been off treatment for such a long time, I feel pretty comfortable making this decision. I know that I'm going to second guess myself, and obviously if I have symptoms come back up, I will reconsider, and I probably at that point would opt to just go on the antibiotics for the rest of the pregnancy. But it's really a tough call, and I feel like it needs to be a really personal, individual decision. So I talked things over with my husband, and he's supportive of kind of whatever I choose to do, and it makes sense to do what I'm choosing. So for now, that is what we're planning on doing for this pregnancy. And we'll kind of see how it goes. I'm nervous about it, but I think I would be nervous either way. There's no guarantee, even if you do treat, that you won't transmit it, and there's no guarantee that if you don't treat, even if you have an active infection, that you'd pass it along. So I think the best that I can do is just kind of try to keep myself as healthy as possible, and then I really feel like breastfeeding a baby gives their immune system a really good start, and so I feel like that is really important to me for doing with my children. So this is kind of like a really long explanation of where I've come from and kind of what brought me to this channel and where I am now with it. My son is really healthy, has not had any issues. I mean, he has he has his quirks and everything, but that's more him than anything that we're concerned about with Lyme. And he did have some feeding issues early on, which can be a kind of a red flag, but they were not anything that indicated that they were Lyme related. So we're just gonna kind of go with it and see how this pregnancy goes. So far, this pregnancy has been kind of rough on me, but not because of the Lyme really, and it has actually really been a blessing that I do still have IV access. I have a port-a-cath in my chest that I can access at home with a needle, and I'm able to give myself IV fluids at home, which has been really helpful, and I have been relying on that a little bit more than I have in recent weeks and months. But that has really, I think, helped me to get through this kind of rough first trimester. And I'm really glad that I do still have that. I've talked in the past about I was considering having the port removed because that would allow me to have a more low-risk pregnancy, and I would have the option of having a home birth or an out-of-hospital birth without the port, because the port puts me at slightly higher risk because I have a history of having had a blood clot related to a port. So during pregnancy with a port, I have to be on blood thinners, which rules out an out-of-hospital birth. I have to be in a hospital because I'm deemed just a little bit too high risk. So I had considered having the port taken out, but I think it was really the right decision to keep it in for now. And the fluids have really been helpful, and I'm really glad that I have that as kind of something to lean on and help me through some of this rough first trimester time. So that is kind of my story and where I am at now. And if you have any questions about any of this or other stuff that I didn't talk about related to this, please don't hesitate to ask. I'm happy to answer whatever questions I can, whether it's just responding to comments or making a follow-up video. But I really want to kind of put this out there and hopefully help other people who maybe are going through similar circumstances and trying to make these kinds of decisions, or just kind of feeling alone in this, because I know that it can be a kind of an isolating thing, and there's not a lot of people who have been out there talking about going through pregnancy with Lyme. So I really want to make sure that I can get my voice out there and hopefully help some other people who maybe are dealing with this. So please, leave a comment below with any questions or anything else that you might want to mention, and I'm happy to answer and comment back as much as I can. So I hope you found it helpful and informative, and thank you so much for watching, and I'll talk to you again soon.